Good afternoon, ladies and gentlemen. Welcome to the BCA-SISO-WSHC Council webinar, Committee of Practice on Safe Management Measures. My name is Hui Wen from BCA. We are very grateful to have Singapore Institution of Safety Officers SISO and Workplace Safety and Health Council in joining us today to organize this live webinar. With more projects restarting work at site, maintaining an established and well-informed safe management officers community is crucial. This webinar will share with you on the best practices for implementation of safe management measures so as to maintain a safe restart on site and safeguard against resurgence of outbreaks. Before we start, I would like to quickly run through some housekeeping measures. Please note that as participants, you're on mute setting. Should you have any questions or if you wish to add to the discussion, you may do so by clicking the Q&A button on your screen to type in your queries on inputs. When we get to the Q&A segment, we will also be activating the raise hand function to take live questions or comments from the audience. Should you wish to ask a question verbally at that time, do click the raise hand icon. Do also note that when the session ends, you will be directed to access an evaluation form after you have exited the webinar. Once submitted, you will be able to download the speaker's presentation materials via the website as shown. Here's an overview of today's program. The webinar co-chairs will first give their welcome addresses, followed by presentations by BCA, SISO, and WSHC Council. The session will then end off with a Q&A segment. Let us first invite Engineer Punithan, Director, Building Plan and Policies Department, Building Plan and Advertisement Licensing Department, BCA, Mr. Niranjan, Vice President SISO, and Ms. Ong Pei Wen,
Hello, can you hear me?
Yeah.
Yeah, hi. Good afternoon, everybody. I'm pleased to have you all today's section. Today is the second round of a webinar that we are hosting together with SISO and WSHC. So I'm glad to get you all to be participating in this. For the past few months, we all been quite tied up with this COVID operations and working on this construction segment to be on a perfect run to make sure there's no COVID cases. So that has been quite substantially well placed in this scenario where we don't have much cases or many cases or zero cases for that fact for the past few months. So that is quite a good deed that we have done. And to keep up the good work, we have been having this kind of webinars so that you're appraised of the issues and also the sharing sessions among the rest of them. And we must not take this into a complacency that there's zero issues or zero kind of cases. We must ensure that we will keep our guard so that we will make this as a new norm that is going to proceed from now on. Whether until and unless we find a vaccine to be placed so that we can work in a different way, but until then, this will be a new norm to proceed from now on. So I hope that this webinar will be a fruitful session for you all. And I'm glad to be partnering with SISO and WSHC. So without further ado, I'll call upon Mr. Nuri to address on his part. Thank you.
Thank you, Engineer Punithan. Can you hear me?
Yes, Mr. Nuri, please go ahead.
Yeah. So good afternoon, everybody. Engineer Punithan Shanmugam, Director, Building Plan and Policies Department, Building Plan and Advertising Licensing Department of the Building and Construction Authority. Ms. Ong Pei Boon, Senior Assistant Director, Workplace Safety and Health Council. SISO members, ladies and gentlemen. On behalf of the Executive Committee of Singapore Institution of Safety Officers, or SISO for short, I'd like to welcome you to this webinar on the Community of Practice on Safe Management Measures, which is co-organized by the Building and Construction Authority, or BCA for short, Workplace Safety and Health Council, or WSHC for short, and SISO. SISO is very pleased to collaborate with BCA and WSHC to bring you this edition of the webinar. A statement borrowed from the recent World Congress: nobody is safe until everybody is safe. And so this webinar is being organized again to reinforce the safe management measures, as it remains to be very important, very relevant, as well as most germane to how we work and how we live our lives for the foreseeable future. While the cases of infection have trickled to a single digit, or as Engineer Punithan just said, they've even come down to zero, we cannot afford to be complacent. Globally, we are seeing a second wave of cases, most notably in countries across Europe, where extended lockdowns are being enforced. We need to continue to be vigilant and compliant to safe management measures. Besides emphasizing the importance of continuing the good practice of safe management measures, I would also like to take this opportunity to say a big thank you to BCA and WSHC for the opportunity to co-organize this webinar. I'd also like to give a shout out to the 700 plus participants who have registered for this webinar. Thank you very much for supporting this webinar. Your massive support and participation underlines the continuing importance of the safe management measures and motivates us to continue to facilitate your efforts in implementing safe management measures. With that, I wish one and all a fruitful and engaging webinar today. And may I now hand over to Ms. Ong Pevun.
Thank you, Niri, and thank you, Mr. Punithan, for the welcome before me. I actually echo the both of you. I agree that, I think COVID-19 is really an event of the century, I must say. And we have had the toughest past half a year or year ahead, a bit before us, which without the hard work of everybody here, as well as all around the nation, not just the government agencies, but every employer and every worker, putting in lots of hard work to try to do what they can in terms of safe management measures at work, which actually led us to the results that we are seeing this past month, where we have really maintained zero community spread, okay? And I really also echo what Niri and Mr. Punithan has said, that let's not be complacent. Let us continue to keep our guards up, continue being concerted in our efforts so that we can continue to stem any potential spread should it come on shore again. And I think that this platform, that BCA and SISO, and we are happy that the WSH Council has been invited to come on board as part of this co-organizing team, to have this platform for everyone, because I think it's an excellent platform that everybody can learn from one another. And I think that's how we grow and improve ourselves. So let's keep this going. We are happy to share what we can, and I think that's a good platform for everyone to also raise issues that you actually face on the ground, so that we can actually crowdsource solutions. Yeah, so without further ado, we just want to thank everyone again for attending, and let's keep this going. And I'll hand over the time to the MC, Hui Wen. Thank you.
Thank you, webinar co-chairs. First up, we have Mr. Alvin Ng, Executive Architect, Building Plan and Universal Design Department, BCA, will be sharing on the good practices and findings of BCA site audit and inspections. Alvin, please.
Okay, good afternoon to all. Today I'll be sharing with you on the good practices so as to prevent and contain C+ infections in your project site. So I will go through the outline for today. So firstly, I will be sharing with you on the key enablers to prevent and contain C+. Secondly, we'll be sharing BCA's audit and assessment findings. Third, we will discuss on the safe and quick resumption of works. Fourth, we will be sharing some good practices to minimize project site disruption. And lastly, some common mistakes that we have found in the restart applications. Okay, so the key to ensure the well-being of workers and to have minimal disruption to work sites is prevention and containment. So prevention is essentially preventing the occurrence of major C+ outbreak on site. And this is mitigated by access control and safe distancing. And on the other hand, containment. Containment is if there's a C+ on site, how do we contain this C+ such that it does not spread beyond the assigned or localized work zones of the particular C+. So under prevention, you can see there's access control and safe distancing. And it is of utmost importance for the builders to ensure that proper site control and adequate SMM are actually practiced on site. For example, the implementation of safe entry NRIC, the use of visual identifiers, as well as staggered usage of common facilities. On containment, the purpose of the safety timeout is essential as it allows the project site to come to a safe stop and to conduct their own investigations so as to ascertain the C+ ring of influence is affected work zones, as well as to conduct disinfection of the project site. Concurrently, we will also have to review the SMM plans to ensure that adequate SMM is in place and there's a low risk of cross-infection. So from June to October, BCA had visited more than 3,000 work sites to assess the adequacy of SMM practices. In the month of October, we found that there are about 7.5% of project sites that were found with SMM breaches. And the common SMM breaches are as seen on screen. So workers are not wearing masks or visual identifiers. They are not keeping to their designated zones. And there was no SMO present when our inspectors went down on site. So for SMM breaches, BCA has also taken enforcement actions on this. Okay, some of the SMM breaches that our inspectors had observed on site include workers not wearing masks. There is no clear demarcation or indication of work zones, and sometimes trace together as not activated on the worker's phone. On the other hand, some good examples of good practices that were observed include the very clear demarcation of work zones with a very clear physical demarcation, I must say, and also the usage of safe entry NRIC, individually packed food, segregation of rest areas, and such. So while we continue to observe good SMM that is being practiced on site, we have also noticed through our weekly audits of safe entry records that a significant number of sites have been allowing raid access code workers into site. And to prohibit this, it's essential to prohibit this raid access code workers to stop the spread of COVID-19 and to ensure that your work site remains COVID-free. So BCA takes a very serious view on this, and we have carried out enforcement actions for sites which have allowed the entry of raid access code workers. And more severe enforcement actions will be taken against repeated offenders. So when we went down on site during our inspections, we found that there was no covering SMO or SDO when the SMO, when the appointed SDO is, or when the appointed SMO is not on site. So we wish to remind builders that if whenever there are works going on site, there must be an SMO present. And if the SMO cannot be on site, or for example, for meetings, or he has to swab test, or he's on leave, then there must be a covering SMO or SDO on site. So while we allow a covering SMO or SDO, they cannot be just appointed on paper, they must be able to take on the role of the SMO, which means they must be aware of the roles and responsibilities, and they have to have knowledge of the site SMM. So therefore, builders and appointed SMOs must take steps to ensure that their covering are made aware of the site's SMM and their roles and responsibilities. So on the rate access code, as I mentioned earlier, they should be turned away at the site entrance. And it's important that in the site, safe entry NRIC must be implemented and not safe entry QR code version. So the reason is because when you set up SCNRIC, this will be able to check the access code of the particular worker, and you should click the box, enable restriction at CMP worksite. So this will allow the system to properly display the access code of the particular worker, and therefore only green access code workers shall be allowed into the worksite. So as I mentioned earlier in the containment section, we will have to issue safety timeout to projects if we found a C+ that has been working on site within the past 14 days. The reason for this safety timeout is for you to carry out the necessary investigations to ascertain the C+ ring of influence. From our observation, most of the STOs were lifted within 3 days. And for the STOs to lift within 3 days, it is dependent on multiple factors. Firstly, it's the speed and response of the builder and the quality and completeness of the SMM plan provided to us. So in the next few slides, I will illustrate the importance of adequate SMM and the prompt response of the builders when their site has been issued an STO. So for the first case study, the builder was able to get back to us quickly on the following day, which is D+1, and he was able to provide all the information that we needed for our assessment. So there was adequate SMM assessed. As such, we could process and review the submissions quickly, and thereafter leave the STO on D+2. So typically after an STO is issued, we will require the builder to get back to us the following day by 2359 with 3 main items. So firstly, the builder's compliance report. Second, SMM plan. Third, worksite safety plan. So these 3 items must reach BCA by the following day, 2359. In this second case study, the builder did get back to us by the following day, 2359. So he got back around 11 o'clock. However, there was some key information in the SMM plan that was not complete. So there was missing movement control plan. There was missing usage of visual identifiers. They were missing follow-up plan and evacuation plan in the event of a C+. So all this information is crucial in the overall assessment of the SMM plan. So do not miss out all this information. And so for this builder, he managed to give us all the information required by D+4. And we have managed to review there and then, and we managed to leave the STO on D+4 as well. In the next case study, this case study is unique because it shows the importance of the builder to be prepared in the event that a C+ case is at site. For this case, when the builder was informed that there's a C+ on site, he was unable to give us the documents by D+1. The reason being because he had trouble accessing the documents because the documents are saved on a desktop computer, which is locked at his project site. And furthermore, the site management team has also been issued QO. So there was nobody that could access the files, and therefore he had trouble submitting to us on D+1. So this is a reminder to all builders that C+ can happen anytime, even during weekends. So you should be prepared to always have this information on hand to furnish BCA. Otherwise, it's just going to delay the lifting of STOs. Okay, so for good practices to minimize work disruption. MOH also advised that toolbox meetings should be conducted in smaller groups if possible at an open air or well-ventilated locations. So it's either in smaller groups or conduct them in staggered timings. Another good practice is for sites which has CTQ or TLQ within the same site. For such examples, there must be a separate SENRIC implemented at the accommodation, which is a TLQ or CTQ. The reason being because if there is no SENRIC, we are unable to trace whether the CTQ worker has actually scanned in at site, and therefore we are unable to trace who is this worker if in the event of a C+. So to ensure only healthy and authorized workers from the CTQ or TLQ to enter the worksite, there should be a segregation between the CTQ and the worksite, and a separate access control system must be used. In this case, it's the SENRIC system. So to illustrate this further, okay, so for this illustration, the gray zones are within the black line is actually the project boundary. So as you can see within the project boundary, there is a CTQ, TLQ, as well as 4 work zones. So for example, if I'm a worker from working in zone A and I'm staying in TLQ, I would need to scan in at safe entry NRIC 2 and SCNRIC 3. In this manner, I'll be able to trace he has exited CTQ at this time and he has entered zone A at this time. So for projects which have CTQ and TLQ, there must be 2 SCNRIC records per worker. Do note that each NRIC is a unique branch code. So for safe entry at work zone level, each work zone should have a different branch code for SCNRIC as well. So this is to detect and prevent the intermixing of workers. So besides that, in the event of a C+ occurrence, BCA can better identify where this sick worker has been to and where he was operating, and therefore we will be able to issue a partial STO to that particular work zone only. So for example, in this project, there was SCNRIC in G4A and G1A. So the 2 red crosses are where C+ had been working, and there was safe entry NRIC implemented in those 2 places, and therefore we will be able to issue partial STO as opposed to the entire site. Yeah, so this will be able to minimize stop work disruption. So as an illustration, again, the gray zone represents the project boundary, and if I'm a worker and I was to scan in the main gate, so I have to scan in at SCNRIC 1. And then if I'm working at zone A, I was to scan in at SCNRIC 2. So this will be able to trace where the particular worker had been. And if he has been working in zone A, then we will be issuing partial STO to zone A. Otherwise, we will be issuing a full STO to the entire project site. And again, I emphasize that each SCNRIC is a unique branch code. They cannot be the same branch code throughout. Okay, lastly, we'll move on to the common mistakes made in restart application. Some of the common mistakes include missing branch code details for safe entry NRIC. There is missing information. The builders will forget to update the work zones, as well as insufficient number of SDOs when you increase the workers to the work site. So an example, everything is nicely marked out here. However, there was missing branch code for the SNRIC in their submission. So in this case, there's no SNRIC. We will have to issue a full STO to the site. Next, in this submission, there was adequate drawing. There was no adequate drawing. It was merely illustration, and it is schematic drawings essentially. So this is not ideal, as you are unable to tell the proper zoning and segregation of the site. So it's best if there's adequate drawings or floor plans that you are actually using instead of schematic drawings. Okay, during the STL Sungai Tengah Lodge period, there was a re-emergence of cases, and we found that there was roving subcontractors that could visit multiple sites. So for this example, we found that there was two roving subcontractors that had visited 3 sites, and we had to issue to 3 sites. So while there were no other C+ diagnosed at these sites, this highlights the risk that roving subcontractors bring to your work site. And if adequate SMM and as is not practiced, then these roving subcontractors could potentially spread the virus to the main workforce of your construction site. So hence, to mitigate this risk and safeguard your main workforce, we strongly urge all builders to follow good practices when these roving subcontractors are deployed at site. So this, for example, you should be wearing stronger visual identifiers that will distinguish them from the main workforce. You have to ensure that the roving subcontractors are briefed accordingly, not to wander around a site. And yeah, they should be briefed on these SMM measures and be informed of the responsibility to avoid interaction with the main workforce. Okay, so in conclusion, the industry generally practices good SMM, and they recognize the importance of good SMM in preventing the C+ infection. As I mentioned earlier, the builders should work with us to facilitate the listing of STOs by providing a complete documentation in their compliance report, SMM plan, and worksite safety plan in order for us to leave the STOs on time. And lastly, builders can ensure minimal work disruption by utilizing SC&IC at work zone levels, conduct toolbox meetings in staggered timings of smaller groups, as well as for project sites which have CTQ or TLQ, please set up separate SC&IC for both sites. Yeah, for that will be all for BCA side. So moving on to the next presenter.
Thank you, Alvin. Next, we have Mr. Lo Zi Kwang, professional member SISO, who will be sharing with us on the SMM in the facilities management sector. Mr. Lo, please.
Yeah, thank you so much. Sorry. Okay. Have I got the control of the slides? Okay, thanks. Good afternoon, organizers and participants. My name is TK Lo from Sodexo Services Asia. I'm also the professional member of SISO. I'm delighted to have the opportunity to share about our new normal control measures in the pharmaceutical sites. All right. Sorry, I can't move. Oh, okay. Yeah, let me share my safety moment. There's 2 safety moments which is important to showcase our control measures at the site. The first one is actually about 3 check for safety. Okay, in this 3 check in Sodexo, right? The first check is if I'm a worker who conducts a job, I will have to ask myself whether do I know how to do the job. If I don't know how to do the job, I will not proceed on. Then I'll go into check 2, of course, if I know. The second thing is to ask myself whether do I have the right equipment, whether do I have the correct equipment, calibrated equipment, and also the right PPE, in this case, under COVID situation, before we carry out the job. The lastly is actually is the environment safe for me to do the job? So this is something that I need to make sure that I'm correct. Okay, so if the environment is not safe, I will not carry on. The next safety moment is about safety nets. Okay, in this safety net, we have 7 safety net. The first one being risk assessment, which is what I'm sharing today. The second one is actually safe system of work. Safe system of work in the European term refers to standard operating procedure and method statement. The third one is a physical barrier and restricted access area. That means, do we have correct tools and PPE? Sorry, I think it's a bit mixed up. The next one, of course, would be safety walk, safety observation, and near-miss reporting. And the last one is actually 3 check for safety. Okay, yeah, this is what my company is doing. We conduct soft and hard services for the facilities for companies who require facilities, and also food services as well. Okay, this is our footprint in the world. We are occupied in 67 countries, and we have around 470,000 people in the world. Okay, so this is the risk assessment that we are using for COVID. Okay, what you can see is that we have the next page. Okay, at the bottom you can see all the PPE control that we're using for the sites. Okay, sorry. Yeah, sorry, this is the explanation about the RA that we are doing, right? Okay, we have identified risks under 5 main groups. The first group is actually the first group we are using, right, is actually the infection through coronavirus at the site level. The second one is actually we realize that there are risks at the site staffing level. The third one, group C, is actually the risk on substitution of chemical and equipment, because we changed the type of equipment used on site. We are using chemical extensively on site as well during COVID. The fourth is actually the risk arising from COVID related on COVID related situation. The last one is actually mental health and well-being. So these are the 5 main groups that we are doing risk assessment. So on the first group, infection from coronavirus, we realized that there are hazards relating to employees having contact with people with coronavirus. Either they are already our staff inside, or they could be visitors visiting our premises. So these are the risks that we are facing. And it could be our drivers who go to the client site to deliver something and they bring back the virus. So all these are our concerns. Sorry, I find it a bit difficult to move the slides. Okay, so for that, right, we have developed some kind of a safe system of work as a guidance for us to follow. Follow. I'm sorry, a bit messed up on the slides. Okay, first thing first, all the staff personnel at the site level, they have the guidance of I'm sorry, the slide setting is a bit messed up. Never mind, let me read from the other laptop. I'm not too sure what happened to these slides. Sorry, something is missing from here. Okay, first thing first, all the staff are trained on coronavirus response, and any symptomatic individual, if they are arriving at the site, right, they'll be rejected. Either they ask them to go home, go and see a doctor, or they will be self-isolated, because there's an isolation room at the site level. And whoever is available to do working from home, right, like myself, then we should work from home. We minimize traveling, and also we split team accordingly. I'm under split team situation right now. So at the site level, we do distancing at least 1 to 2 meters, and we mark down on the floor to make sure that everyone follow about the distancing. And we have also all the guidance posters around, like how to wash hands, how to maintain distancing, and all that all over the site. And at the site level, we avoid having face-to-face meeting. And when we need to meet at the site, right, we try to use any video conference or teleconference like what we are doing right now. Most of the time, we are using Microsoft Teams, WebEx, or Skype to do this kind of meeting. And we also encourage hand washing, about 20-second rule, and we have this poster around. And at the site level, everyone, before they do the job, even though they have risk assessment, they are supposed to conduct 3 checks for safety before they do the job. because the risk assessment may not have covered the exact condition of the site at that moment. So we need to check through a tree check. And the supervisor level, they have to adhere to 7 safety nets to make sure that we are safe. And just to let you know that the 7 safety net is an important tool for us as a guidance. And also in time when we need to conduct incident investigation, this is a good guidance for us to conduct investigation to see what are the lapses. Okay, so every team member will be fully trained on the safe work procedure and risk assessment. If there's any person who is redeployed from other site to our site, they will undergo a very extensive induction training. Okay, so in the event if there's a suspect cases happen at the site, what we do is before we can confirm whether this is a real case, we will try to evacuate the people within that neighborhood or that building, let them go home, work from home. And then what we do is we hold up for 72 hours for monitoring. If the response come back from the hospital to say that this person is negative, then we will do a thorough cleaning before everyone come back on the 3rd day. Okay, so if 72 hours later. But if this is a positive case, what we will do is we do disinfection, getting the professional people from the NEA listing to do the disinfection, and we will not do it ourselves to risk our people. Okay, so the next grouping of the risk assessment, the hazard identification, is site staffing level. So this site staffing level, because we realize that there is a hazard when safety critical personnel are not able to show up at the site because of self-isolation or because they are sick. Okay, so what are the important things that we are looking at? Because these people may be responsible for maintenance of the fire system. They take care of the fire cert renewal, testing, and also there are people who are shouldering responsibility as a fire marshal, fire wardens. They conduct evacuation drills, and maybe they manage the preventive maintenance plan for the building, plant and machinery, maybe lifting equipment, electrical inspection, testing, and electrical license renewal, and so on. And there are people who are managing the safety critical equipment or responsibility, for example, Legionella management. Because at the site level, we have a lot of cooling towers and water features. We have to ensure that every single item of them are being serviced, maintained, tested, make sure that they are safe, because we can't afford when we prevent to have COVID infection, we can't prevent. We have to prevent an outbreak of Legionella disease. Okay, so if in the case when we manage the commercial sites where we rented from the landlord, we will monitor for the landlord, because just in case there are lapses, because we notice that in other countries, because I'm a regional person, there are some of the sites are being overlooked by the landlord. Not every landlord, like in Singapore, they are so efficient. Okay, Singapore landlords are the most efficient in the world, I would say that. And we have to monitor for them and push them, make sure that they deliver. So this is what we have been doing. All right. Then we also make sure that when we have redeployed any staff to other sites, we have to make sure that they have a proper transition before they go over. Similarly, anyone coming over from other site to our sites, they have to be properly transited. They go through proper training so that they don't fail. Important thing, they must know the safe work procedure. They must know the emergency process and the RA. Okay, so over here, at the staffing level, right, I think I have already touched on a lot of this, but the two important thing is 7 safety net and 3 check for safety. And at the same time, we must have a 1 meter, minimum 1 to 2 meters distancing. And our drivers, when we need to travel to other sites, we want them to make sure they carry their PPE. Okay, they have the mask, they have the gloves, they carry themselves with sanitizer hand gel so that they can sanitize themselves at all times. And one thing I need to mention that some of the facilities, what we are doing, right, we may have a chance to work under the condition when we have less than 1 meter distancing. So how do we do this? For example, one of the example I can remember, we do aircon maintenance. Okay, because we need to stand on a staging with 2 persons, both dismantling a fan coil motor. So when these 2 persons stand together, they can't be far away because they have to carry the heavy item together. So what we do is we will disinfect the equipment that they are going to be working with, disinfect their hands. Of course, before that, we have done all the clearance, check the temperature, declaration, and so on. And before we do all this job, to make sure everyone is safe. Anyone who has a chance to touch the equipment has to be have to go through all this safe process before we start. Sorry, can't control well on this. Okay, on the substitution of chemical equipment, right? We noticed there are two hazards because all the time we hardly use this kind of chemical for sanitization, for disinfection, for cleaning, and so on. And now that we have all this chemical bring to the site, and what we do is, as a health and safety professional, we have, for me as a regional manager, I have a team of people in all the country. They are also helping me to run the show by doing cost assessment. In our context, cost refer to control of substance hazardous to health. Okay, they will do all the assessment to find out from the SDS, from the actual product on site, to identify the hazards, and they conduct risk assessment, they conduct safer procedure, and also make sure that the team on site are well trained on the use of chemicals so that we are not putting ourselves at risk. Okay, the next one would be control equipment. We are using equipment that are probably previously not using it on sites. Okay, because of COVID, we are using some of the equipment to do the job ourselves on site. So we are also doing safer procedure, risk assessment, and make sure that the people are all trained, all well trained. And after being trained, similarly, a very important, powerful tool that they need to do is pre-check for safety before they do the job. Okay, I'm supposed to go to item number D, but I don't know why this is skipped. Let me run through, but when you have my slide later on, you will have a complete set. Okay, item number D is actually coronavirus related closure. First thing first, when we close the site during COVID, during circuit breaker, we have to close some of the site except for the manufacturing plant, where we close certain part of it, but not completely of it. We have to make sure that we manage any chances for COVID contamination. We have to manage in case there's a growth of Legionella in the water system or any water system, any of the water feature and so on. We have to make sure that there is no expiration of the statutory equipment arising because of closure and subsequently because of the opening. So what we do is, I have mentioned earlier before, but we have to make sure that all these systems are clearly monitored, and our people, we under split team arrangement, right? We have the people when they manage this kind of statutory equipment, there should be a buddy who cover duty for, assuming the team A is managing, team B is on working from home. So they will actually have to consult each other and work with each other through remote conversation, through this kind of virtual conversation that they work together. So in fact, we also have a SharePoint by the global team to put in a lot of processes for us to make reference to if we are not sure, or if anyone has any doubt of it, they can refer to. And as I said earlier as well, we also monitor the performance by the landlord to make sure that they manage the system well so that no one is at risk. Okay, well, now finally this one come. Okay, I need to show the number E, but I'm not seeing. This E is actually mental health well-being. Okay, and I think during the COVID situation, a lot of people suffer mental health in mental health situation. So because of the work stress, because of uncertainty of the job, they don't know whether they are going to lose a job. Probably they have friends or family infected with COVID, or probably because of the reduction in the scale of the job, some are losing the job, which is quite obvious that I can see in the market. People are losing the job. They are asked to leave because of job minimization. So as leaders in the regional level and country level, what we do is we actually work with them. We monitor the situation. If we find that any of the team members are not doing well, we will escalate it. Okay, we will go through many of the conversation engagement to engage with them through coffee session. When I say coffee session, refers to virtual coffee session. We really drink coffee in front of them. Okay, everybody was so relaxed to drink coffee together, and even can have lunch together through a session like this. Between yourself and myself, we can actually have some casual session to be together. We conduct training. We do tabletop exercises through this platform, and we share some of the safety share, quick share, safety moment as well as part of the encouragement, so that the team will actually improve their work. improve their spirit as well. Okay, so you can see the next page, right? We have some of the engagement activities through on-site engagement, toolbox talk, virtual alignment, and you see those under EHS lead, those are by myself that I do a lot of training during this period. Okay, I want to make sure that they are engaged, they don't feel alone. So this is the whole stretch of training program that we have been doing since circuit breaker and before circuit breaker, because I started on 6th April on this aggressive program for them. So they actually benefited. Okay, they don't feel alone. They feel that they're being engaged. This is a BCP training that I did. Okay, this is one of the program that we have is 3-check for safety for anyone who commute through public transport. Initially, a lot of people felt very unsafe to come back. So we have some write-up for them as a guidance. So this is actually a safety moment for mental health support. And I draw this picture just to give them the motivation to feel that they are not alone, we are together. Okay, there's even Chinese wording for those who read Chinese so that they feel encouraged. Okay, there's some illustration over here. Every frontline person are being trained on PPE donning and doffing. Okay, so I have actually done a video of myself putting on the gown, the coverall, and taking it off safely. So everyone get to train and retrain because the video is in the SharePoint, so they can actually download from there to watch. It's just like internal YouTube for them. Okay, so another, I can't see another slide. Okay, we are actually having some okay, some of the system for us to check the temperature before we reach the office. Okay, so these are the apps that we have. So these are the instructions that we have on safe distancing, bring our own calories and so on. Make sure that we have a safe distancing. We don't squeeze into a meeting room together. Usually if a meeting room for 4 person become two person become 1. Frequently we use the meeting room with 1 person because we are doing conference call very frequently. Okay, this is the marking that we have done on site through all the lift lobby and up to the meeting room inside. Okay, this is the manufacturing plant meeting room and office room. This is the food services we have. There's another earlier one. We are doing kitchen food preparation. Unfortunately, you can't see it. I'm not too sure why. This is actually the food serving area. This is the BCP tabletop exercise which I conducted last month. I think this month, sorry, it's just for the team to be engaged and they become very familiar with the BCP requirement during COVID period. Okay, this is what we have on-site maintenance program. They are doing landscaping work, aircon, checking, cleaning work, and so on. This is a mini project work at the site. Okay, this is a client recognition program. The client recognizes us for a good job done on the site. This is one of the wonderful things we do. Call it Servathon 2020. Sodexo is one of the program lead on fight against hunger. We organize training program. We organize some of the sports event like yoga, run, swim, culinary masterclass because we do cooking as well because we are a food services company apart from FM. So from there, we actually raise fund so that we can prepare food to serve the needy. We distribute food to their houses. You can see all the plastic bag that we're carrying. All these are food here. We have also something called remote management through this smart glass technology so that we can reach out to the site without physically being over there. This is to bridge the gap when we have on COVID, all right? And this is the benefit of having this smart glass system. Yeah, I think that's all for my sharing. I'm sorry for the system issues. If there's any question, you can ask during Q&A. Thank you so much.
Thank you, Mr. Low.
Thanks.
Lastly, we have Mr. Jasper Ong, Manager, Industry Development Department, WSH Council, will be sharing on the total WSH in the midst of COVID pandemic. Jasper, please.
Thank you, Hui Wen. Hello, everyone. Good afternoon. My name is Jasper. I'm from the Workplace Safety and Health Council. Okay. I think the two presenters before me, Alvin and TK, have shared quite a lot of useful tips that we can protect ourselves, our workers, and even our work sites from the COVID. Me being from Workplace Safety and Health Council, I'd like to share with you more tips and resources and even programs from us on how you can protect your workers from the pandemic. Before I start my presentation, I'd like to show you a quick video. I hope you'll like it. Here it goes.
In the 1950s, the Dayak people of Borneo, an island in Southeast Asia, were suffering from an outbreak of malaria, so they called the World Health Organization for help. The World Health Organization had a ready-made solution, which was to spray copious amounts of DDT around the island. With the application of DDT, the mosquitoes that carried the malaria were knocked down, and so was the malaria. There were some interesting side effects, though. The first was that the roofs of people's houses began to collapse on their heads. Turns out the DDT not only killed off the malaria-carrying mosquitoes, but it also killed a species of parasitic wasps that had controlled a population of thatch-eating caterpillars. Thatch being what the roofs of the Dayak people's homes were made from. Without the wasps, the caterpillars multiplied and flourished and began munching their way through the villagers' roofs. That was just the beginning. The DDT affected a lot of the island's other insects, which were eaten by the resident population of small lizards called geckos. The biological half-life of DDT is around 8 years, so animals like geckos do not metabolize it very fast. It stays in their system for a long time. Over time, the geckos began to accumulate pretty high levels of DDT, and while they tolerated the DDT fairly well, the island's resident cats, which dined on the geckos, did not. The cats ate the geckos, and the DDT contained in the geckos killed the cats. With the cats gone, the island's population of rats came out to play. We all know what happens when rats multiply and flourish. Pretty soon the Dayak people were back on the phone to the World Health Organization, only this time it wasn't malaria that was the problem. It was the plague and the destruction of their grain stores, both of which were caused by the overpopulation of rats. This time, though, the World Health Organization didn't have a ready-made solution and had to invent one. What did they do? They decided to parachute live cats into Borneo. Operation Cat Drop occurred courtesy of the Royal Air Force and eventually stabilized the situation.
Okay, I hope you enjoyed the video, but I wonder how many of you are like me and wondered how did the cats actually take off the parachute when they land. But anyway, that's a joke. Jokes aside, I hope that the video showed you that if we don't understand the interrelatedness of things, solutions can sometimes cause more problems. So later as I progress through my slides, I will show you more of such examples. But I'd like to begin talking about how COVID affected us. So like as the other presenters have shared, the pandemic has caused a massive impact on the global economy and brought about unprecedented challenges for businesses, especially the construction industry. And I say that because we all know that COVID is a virus that infects human beings, and the construction industry, being one of the most labor-intensive sector, obviously took the heaviest hit. So when Singapore went into a partial lockdown or circuit breaker as we know it, construction companies had to halt their ongoing projects and find ways to protect their workers from the virus. So these include looking for lodging to house their foreign workers in separate locations, making arrangements for meals to be delivered to their workers, and even arranging for their workers to be swabbed periodically, just to make sure that they do not infect each other and still maintain in good health. So this is certainly not an easy task for the employers. So when the construction sector was finally allowed to restart work, the challenges did not end there. Construction companies have to quickly put in place safe management measures, or in short S&M as we know it, such as segregating the work site into zones and implement staggered timings for the start and end of work, and so on. While it is true that these safe management measures have been effective in curbing the transmission of COVID in the workplace, these measures have also introduced a new set of health and safety issues, just like the example we have seen in the cats in Borneo video earlier. So take a look at this picture. Quite often, this is the standard PPE a construction worker had to wear while he or she is working. In 2020, picture this. So what I like to show here is that when the workers restart work after the circuit breaker, they had to quickly adjust to new norms, such as wearing a face mask on top of their usual PPEs during work. As most of us are aware, most work sites are often hot and stuffy. So this inevitably led to workers experiencing some symptoms of thermal strain, such as excessive sweating, exhaustion, and even dizziness. These health issues, if they are not quickly addressed, can lead to potential workplace accidents. But perhaps one way the employers can consider to alleviate this problem is to provide ice water at water points and more frequent water breaks, so that the workers can keep themselves properly hydrated during working hours, while at the same time, the ice water will help to lower the body temperature of these workers. Next, we all know that the work sites are high-risk environment where accidents can easily happen if we are not careful. So with the newly introduced SMM measures, such as color coding the work sites into different zones to separate the workers, they may feel less familiar with the safety measures, especially after a period of inactivity. This combination could be a cocktail for an accident waiting to happen. Well, we can address this issue by familiarizing the worker to his or her allocated work zone by physically walking him or her through the demarcated work zone before work commences. But the point I like to make here is that from the two examples is that in the midst of attempting to control the spread of infectious disease, we should also be mindful that it could potentially result in health or other issues and address them in a timely manner. So before I continue further, I'd like to show you an example of how work, safety, and health are interrelated. So without further ado, I'd like you to meet my friend Bob. Although he's tiny, he's in his late 30s. And because he loves sweets, so unfortunately he has diabetic. But he's a construction worker who recently just returned back to work after circuit breaker. And he works 9 hours a day plus 2 hours of OT each day. So like I just mentioned a moment ago, Bob just returned back to work recently after months of being away from work from the workplace. But with the SMM being implemented in his workplace, Bob is still adjusting to the new work environment and is trying to remember the work processes. But then his employer, Gru, instructed him to work faster because their project is way behind schedule. Now, because of these issues and pressures, Bob felt mentally stressed. And as a result, he could accidentally injure himself while working. Okay. On the other hand, with the newly implemented safe management measure, Bob's worksite have been segregated into different work zones. So now Bob has to take a longer route to the rest area. Remembering his employer's instruction to pick up his pace and work faster, Bob decided to skip his break time so that he could finish his work on time. At the same time, he also feared that he might get dismissed by the company if he does not meet their expectation. So because of this, Bob decided to push his limits and take up more OT, and at the same time, skip his medication for diabetes, thinking that he would be fine. But unknowingly, his diabetes started to get out of control, and over time, this could lead to more health issues, and Bob may have to take more frequent MCs. So what I have just shown you is the interrelationship between work and safety and work and health. Okay, so from the company's perspective, poor worker safety records can definitely lead to economic and reputation losses to the company. Say, for instance, if the company receives a safety timeout or a stop work order. So in a sense, this affects the company. And at the same time, if we have more workers like Bob taking frequent MCs, this will definitely affect productivity and cause delays to work. So what I'm trying to say here is the short-term productivity gain from the workers working overtime may not even offset the delays caused to the whole project if we do not take care of the workers' health and they start taking more and more MCs. Lastly, because Bob failed to take his medication regularly, he wasn't able to keep his health condition under control. So this may lead to other complications such as fainting spells while he's working, which could then lead to accidents, which is the relationship between health and safety. And on the other hand, if Bob were to get injured during work, his wounds could potentially get easily infected because of his uncontrolled diabetes. So this is how safety can affect his health. So I believe most of you here are already well versed in addressing workplace safety and occupational health. So I'm not going to dive deeper into this subject. But how about personal health and well-being of the worker? Now that we have seen how the triangle work, safety, and health are interrelated, the next question is, how do we then identify and address these issues? So simple initiatives such as making sure that the workers are getting sufficient rest after work, taking meals and breaks regularly, making sure that they are coping well with the work assigned to them, or even encouraging them to practice healthy living and eating at the workplace can go a long way in improving the workers' personal health and well-being. So apart from the initiatives that I have mentioned, I would also like to use this opportunity to introduce you to the Total Workplace Safety and Health program. Now, in short, Total WSH is a holistic and integrated approach to manage the interactions between work, safety, and health so as to promote the well-being of workers and employers. But if you find that hard to understand, please don't worry, because I'm happy to share with you today that the Total Workplace Safety and Health program is funded by Health Promotion Board. So if you were to embark on this program, there will be a Total WSH service provider that will work hand in hand with you to help you identify the risk at your workplaces and recommend practical solutions to address them through AIME. So what does AIME stands for? It stands for assessment, intervention, monitoring, and evaluation. In a nutshell, assessment means finding out where are the lapses and areas for improvement in the workplace. Intervention meaning coming up with programs to address these issues. Monitoring being keeping these intervention programs in view and periodically check their progress to see whether they are working. And evaluation as a conclusion to see whether or not the situation have improved because of the program. But of course, if you like to know more information about the Total Workplace Safety and Health program, you can always approach us and we'll be more than happy to share more in-depth on the program with you. Okay. Now, I would like to give you a glimpse of one of the things that we do to educate companies through the Total Workplace Safety and Health program. That is to consider health risk when you do risk assessment, especially for safety critical roles. Some examples of safety critical roles are driving, if you are in the L&T sector, welding, if you are in construction or the shipbuilding sector, or even working at heights. So what we do is we educate workers who are in such safety critical roles what they need to do if they are feeling unwell. And it's as simple as SIT. So what does SIT stands for? S stands for stop. So when you are feeling unwell, the first thing you need to do is to stop the work that you are doing and inform your supervisor. So some of the symptoms can include sudden giddiness, fainting spells, or even blurring of vision. So these symptoms, in a sense, are quite severe, and it can lead to a total blackout or leading you to collapse in the workplace. So what do you need to do next is to inform your supervisor so that your supervisor is aware of your medical condition and can keep a lookout for you or assign you other jobs, taking into consideration your medical consideration. So the last thing you need to do, or the worker needs to do if they're feeling unwell, is to treat, or in another word, to consult a doctor. So it's important that when you consult a doctor, inform the doctor what does your job require you to do. Because without understanding what you do, the doctor may not know what kind of drugs to prescribe to you or what kind of treatment to recommend you. So for example, I mentioned driving in the L&T sector earlier on. So if you were to inform the doctor that you are a driver, then perhaps he may recommend you other forms of drugs that may not induce giddiness or drowsiness. So at least you can still carry out your work. But if there are no other forms of alternative, then he may give you an MC instead and recommend that you stay at home and rest. So this is why it's important to also inform the doctor what your job requires you to do. Other things include asking the doctor for any precaution that you need to take from your medical condition, because we are not doctors. We may not know what our medical condition can cause us, or even the drugs that we take, what can it cause us. So it's still better to ask the doctor. Lastly, also ask the doctor if you can continue with your job or you need any form of modification in your job. The worst thing or the last thing you want to do is to be a gung-ho and go to work while you're feeling unwell and collapse at work and endanger yourself or your fellow colleagues. Now, in a nutshell, this is what we teach companies when they embark on TWISH program. But if that is not enough to convince you to embark on the Total Workplace Safety and Health program, let me give you another reason too. So for those of you who read the news regularly, you have noticed that recently there have been more emphasis on tackling the mental health concerns of workers. Last month, our Prime Minister Lee Hsien Loong announced a new interagency task force to tackle the psychosocial impact of the COVID-19 pandemic. As Prime Minister Lee said this at the launch, and I quote, "The pandemic has brought about more stresses, pressures, and disruptions, and we see this especially in the workplace. Therefore, protecting workers' mental health has become even more important, unquote. So last week, during the opening speech for the Workplace Safety and Health Conference 2020, Minister for Manpower, Mrs. Josephine Teo, announced the launch of the new Tripartite Advisory on Mental Well-being at Workplace. The Tripartite Advisory sets out practical guidance on measures that the employers can adopt to take care of their employers' mental well-being, and the resources employers and self-employed persons can tap. If you are interested, you can download a copy at the URL on the screen. So, if I may summarize, in today's context, work-related stress is becoming more prevalent. Work stress is a direct result of imbalance between perceived demands, resources, and our individual characteristics. In coping with those demands, while certain amount of stress can improve motivation and performance, extreme stress or prolonged exposure to work stressors can have a negative effect on health and well-being. And the effects of stress may vary from person to person, affecting well-being and performance to different extents. And the impact of extreme stress on physical and psychological health can cause suboptimal performance that may affect safety and reduce productivity. So to quickly share with you some of the recommendations in the Tripartite Advisory, I'd like to introduce you to the GREAT approach. This is something that I've summarized, but it's not the full recommendation from the Tripartite Advisory. So number one is to give access to anonymized counseling services to your workers. Number two, raise awareness on mental well-being and mental health conditions with your workers so that they are aware of such situations. Encourage employers to form informal support networks such as peer support programs so that they can buddy up with each other and support each other through this, bad times. Number four, accept employees' feedbacks and be open to their suggestions to improve work conditions and processes. Because bosses, sometimes if you're not on the ground often, you may not know what they are doing. Workers know what they're doing best. So sometimes it's good to be open and listen to them. Last but not least is to train supervisors to spot signs of mental distress early. So for those of you who are keen to adopt a more practical approach to assess and identify the common stresses in your workplace, you may consider our online self-administered psychosocial health assessment tool known as iWork Health. The link is also provided in the slide. But what I want to say is, what if I tell you that iWork Health is also covered under the Total Workplace Safety and Health Program? So if you consider that the Total Workplace Safety and Health Program is funded by Health Promotion Board, then wouldn't this be an attractive program for a total workplace safety and health solution to build a healthy workforce and safe workplace? With that, I'd like to share with you one quote that was shared by Mr. Nasir Yassin, the CEO of NAS Daily, that resonated deeply with me. So last week, during the Workplace Safety and Health Conference, he said this: one employee can help to elevate your business from 0 to hero. But one employee can also destroy your business. So what you need to do, treat your people as king. Now that I've come to the end of my presentation, I'd like to end off with a video. Thank you.
I money make ready, then go back Bangladesh. I buy cars. I can must merit.
梦想就是想在新加坡开一家属于自己的中餐馆。
不说认得了。
How's going? Hasta pegos, como pichín.
我来新加坡就是想赚更多的钱，然后让我的家人过上一个幸福的生活。Save money after go Bangladesh, after bring a 5-floor building, then other people happy, I also happy. This my dreams.
இந்தியாவில் வந்து மோஸ்ட் ஆஃப் த பிளேஸில் வந்து விவசாயம் அந்த அக்ரிகல்ச்சர் தான் எங்கள் பிளேஸில் பண்ணிகிட்டு இருக்காங்க. அதை வந்து நான் பாதுகாப்பான முறையில் பண்ணணும். இன்னொன்று இயற்கை முறையில் விவசாயம் பண்ணணும். எந்த கெமிக்கல் யூஸ் பண்ணாமல் இயற்கை முறையில் விவசாயம் பண்ணால் தான் நம்ம சாப்பிட்ற ஃபுட்டு நம்ம உடம்புக்கும் ஹெல்த்தியாக இருக்கும்.
சிங்கப்பூரில் வந்து குப்பை போட்டால் அந்த ஸ்பாட்லேயே ஃபைன் அடிக்கிறாங்க. இந்தியாவில் வந்து குப்பை போட்டால் யாருமே கண்டுக்க மாட்டேங்கிறாங்க, அப்படியே விட்டுட்டு போயிடுறாங்க. அதை வந்து ஒரு இதுக்கு கொண்டு வரணும். அதான் என்னோட ஒரு ஆசை. குப்பை போடாமல் ஒரு சுற்றுச்சூழலை நல்லா வச்சுருக்கணும் தான் என்னோட ஆசை.
我的愿望是每个国家都像新加坡那样一样和谐。我回家就要开一个素食餐厅，要让每个人都习惯吃素食，不要吃肉，少杀生。
想在工作的剩余时间学一些英语，可能会给自己带来一些升职的机会，然后去好实现自己的梦想。通过语言交流更方便一些。A B C D E F G
இப்போ நான் வந்து அந்த அளவுக்கு படிக்க முடியல. அதனால தான் நான் இந்த ஃபீல்டில் கன்ஸ்ட்ரக்ஷன் ஃபீல்டு அந்த மாதிரி இல்லாட்டி நான் ஒரு ஐடி படிச்சிருந்தேன்னா அந்த கம்ப்யூட்டர் ஃபீல்டில் கூட வேலை பார்த்துருக்கலாம். ஸோ அதனால் நம்ம பிள்ளைங்களை நம்ம நல்லபடியாக படிக்க வைக்கணும். அவங்கள நம்மளை மாதிரி வேலை பார்க்க வைக்காமல் அவங்க ஒரு கம்பெனியோ இல்லை அவங்க ஒரு பிஸ்னஸோ ஆரம்பிக்கணும். அந்த அளவுக்கு அவங்கள படிக்க வச்சு நம்ம சப்போர்ட் பண்ணணும்.
ฝันก็อยากจะมีธุรกิจเป็นของตัวเองเป็นซูเปอร์มาร์เก็ตประมาณนี้ที่ขายพวกเกี่ยวกับหลายๆอย่างที่ใช้ในชีวิตประจำวันของคนเราก็อีกอย่างหนึ่งถ้าเป็นงานอย่างนี้เราก็ได้อยู่ในครอบครัวคือจะไม่ได้จากกันไปไหนความใฝ่ฝันก็อยากได้แค่มีที่ดินเป็นของตัวเองแล้วก็คิดว่ามีครอบครัวสันติสุขแล้วก็อยู่พร้อมหน้าพร้อมตาให้ลูกว่าตรงนั้นก็มีมั่งมีเหมือนเพื่อนบ้านเขาเราไม่อยากให้ลูกลำบากเหมือนเขาเราอยากให้ลูกรู้ว่าเราทำทุกอย่างเพื่อเขา
Just one more last point from me before I leave. We have prepared a very short feedback form. So it would be very awesome if you can spend a few minutes to leave us feedback so that we know how we did for this sharing. With that, I end off my presentation. Thank you.
Thank you, Jasper. We will now move on to the Q&A session. Together with the three webinar co-chairs, we have Mr. Davinder Singh, Principal Manager, Occupational Safety and Health Unit of MOM, and colleagues from BCA to join us on the panel. You may participate in the conversation by posting your questions via the Q&A button on your screen or by clicking the raise hand button to ask verbal questions once we have activated the function. Over to you, webinar co-chairs, please.
Yeah, hi, thank you everyone for sharing, and that has been a fruitful session. Could I just get your, because of the constraint of time, could I get the participants to get any questions, please? Thank you.
We have activated the raise hand function. Okay, first in line, we have Prabhu Khan. We have allow you access to unmute yourself. Could you unmute? Thanks.
Yeah, please unmute yourself and clarify your questions, please. Thank you.
Are you there, Prabhu Khanan? He's not responding. Perhaps we could wait for the next raised hand.
It's either that many of you all are familiar with what's to do for the COVID, and the presentations have been quite clear. So there's not much of a questions, I suppose.
Co-chairs, there's a question from the audience in the chat function. The question is, how long can SMO go on leave before MinCon needs to reappoint another SMO? And also, can SDO replace SMO during SMO's rest day?
Okay, I can take this on. Basically, SMOs can go up to maximum of 3 days, and SDOs can replace SMO during the rest days as long as the record has shown that they are replacing. And the most important that we notice most of the time when we go down to site is that the covering officers or the covering personnel are not familiar with the SMM practices. So I hope the SMO, when they get the covering officers, do brief the SDO or the SMO the practices so that when the inspectors go down, they are quite familiar with the procedures.
There are two other questions. Number one, what is the maximum packs allowed together for a toolbox meeting? And the other is, can we conduct internal staff meeting in meeting rooms instead of virtual? If so, what is the maximum packs allowable?
Okay. Actually, the MOH has not come in to say what's the maximum packs allowable and all that. But the toolbox meeting, they try to limit the sizes as small as you can. The reason is that the more the people you have, if there's touch wood, if there's any kind of a spread of a COVID positive case, then all of them will be affected. So we are trying to, MOH is trying to advocate to break down your toolbox meetings so that you can minimize the numbers and have meetings in a different form. And for the meetings that you have at the work site, we will prefer, MOH or anyone would say that it is better to have it virtual rather than to have it physical, unless and otherwise it is really necessary. So as much as possible, we will try to say that have a meeting which is virtual and reduce the number of inspections which is physically required. All right, thank you. And there's one question, I think, on the ending in a month's time, the project, and they're going into DLP. So if your project is ending in a month's time, what you got to do is to inform my officers in BCA through the daily report that the works are going to be completed, so that at the back end we can take a note and we will record it, so that the inspections part and all that will be noted down.
Thanks, Co-Chair. There are three other raised hands. The first in line is Gola Sanjeev. Could you unmute yourself? Gola Sanjeev, could you unmute? Thanks. If not, we'll move on to the next one, Muhammad Firdaus.
Yeah, hi, can you hear me?
Yes.
Okay, my question is about the non-dormitory workers, those work permit holders and SPAS holders, they are not living in dormitory. So are they allowed to taking public transport on the rest day?
Yeah, can Sebastian please answer this? Thank you.
Right. So for the safe transport requirement, this for workers that are not staying in dormitory but are working on construction site, right? They are supposed to follow. They must take dedicated transport when going to work. There is no requirement saying that in terms of the off day, But then we advise for employers and even workers to refer to MOM advisory for further guidelines or any latest guideline if there is any. So far, we don't think there is any. But in terms of safe accommodation for construction workers by BCA, is purely for workers that are going to construction sites to work or workers. Yeah.
Yeah. Thank you, Sebastian. Delvinda here from MOM. So I confirm that for those not staying in dormitories, there is no instructions for now in respect of taking public transport. The key aim for MOM at this stage is for workers residing in dormitories. So that's our concern at this stage. So that's why for those residing in dormitories, the rules are stricter. You will have to take company transport to and fro work. And the only time you can take public transport is during your rest days. And that is also only to a recreation center and back.
Okay, I understand. Thank you.
Thank you. Next in line, we have Muhammad Ridwan. Could you unmute yourself? Muhammad Ridwan, are you there?
Hello.
Hi, yes, Ridwan. You can ask your question.
Yeah, hi. My work site have two groups of workers from two different kind of dormitories. So I would like to inquire whether is it allowed for us to separate them into just two zones? Because currently we have so many zones in our work site. We have 8 zones.
Just to get your questions, Rizwan, is that your point is that you have 8 work zones, you want to reduce it to 2.
Yeah, correct. Because they live in only 2 different kind of dormitories.
Okay, we don't have a guide to say that how many work zones and what's the number of work zones supposed to be stipulated per site. We leave the risk management to the site builder. But however, the risk is that the lesser number of work zones, the more effect it will become when there's a COVID positive case. The number of workers affected will be more. So that's the reason that actually we were trying to say that if you were to minimize this risk with the work zones, then when we give a safety timeout when there's a COVID positive case, we can look at it at the point when these work zones were affected only. So if it's a larger the work sites or the work zones, the more the effect will be when there's a COVID positive case.
Okay. So, but what is the maximum numbers of workers allowed to be located in one work zone?
We don't have any guides like that. What we're trying to say is that you have to have the safe distance practices, which is the 1 meter apart. And as long as this is being practiced, the size of the work zones is up to the builder to demarcate.
Same goes for the size of the number of workers for each zone, up to us to control the risk.
Yes, correct. So the 1 meter distance has to remain, but we will say that the lesser, the better for you to control. The more you have 100, 200 workers or 50 workers, the issue will be that when there's a COVID positive case, the risk is higher. For all these workers has to be isolated or they have to be issued with a QO.
Yeah, understood.
Okay, so thank you.
We have one last question from Aloysius Ho.
All right.
Could you unmute yourself? Thanks. Aloysius Ho, please. Aloysius?
Okay, I think we are not able to get Aloysius.
Okay. Webinar co-chairs, it's about time to round up the session. Do you wish to give a closing remark?
Okay, I would like to thank everyone again for joining us in this webinar, and CISO and WSHC to also co-participate in this together with us. And we will hope to get such webinars in future more and share new things which in this area, how to improve in the scenario for the construction sector to move on. And we will definitely see that hopefully that there's a vaccination coming soon so that we can all work safely as what we are doing now. So with that, I thank CISO and WSHC for also cooperating and coordinating with this. Mr. Nuri, any final remarks, please?
Yeah, thank you, Engineer Punithan. We are also very honored to be connected with this series, and we would continue to be engaged. Today, especially, I'd like to congratulate the three presenters and who did a wonderful job in presenting. And we'd like to see this taken up by the people who heard these presentations, who received these presentations, and I hope you can take away some very good bits which were in their presentation. I, for one, I'm definitely going to contact two of the presenters with specific questions. So with that, we'll be happy to join any future co-hosting of these sessions. Thank you.
Yeah, thank you very much, Mr. Nuri. Ms. Pei, any other final words from you, please? Thank you.
No, not much. I thought that I also personally enjoyed the presentations from the three speakers. Thank you to all three of them for the work done and the good job done. So I just want to, I hope all the attendees today have found the sessions useful, and I believe as the slides gets communicated out, they could actually draw more on the circulation of the materials, and I really just wish everybody to stay safe, stay healthy. Yeah.
Yes, with that, stay safe and stay healthy. All right. See you all in the next webinar.
Thank you, everybody. Thank you. Bye-bye.
Thank you, webinar co-chairs and panelists. We have come to the end of this session. After exiting this webinar, you will be directed to access an evaluation form for today's session. Once submitted, you will be able to download the speaker's presentation materials via the website as shown. On this note, we thank you for your participation and making this webinar a success. We wish you and project team a safe and smooth restart. Signing off, this is Hui Wen from BCA.